A top Scottish health expert has issued an urgent warning following a deadly outbreak of meningitis. 2 students have tragically died and 11 remain seriously ill in hospital following an invasive outbreak of the disease in Kent. Extraordinary scenes unfolded this week, with queues of mask-clad people waiting for antibiotics and at least 3 schools confirming cases. Health chiefs are urgently trying to find anyone who may have been exposed to the illness in a bid to stop the spread. Paramedics in hazmat suits could also be seen treating at least 1 pupil on the University of Kent campus. The strain is understood to be a type of meningitis B, known as Men B, which can kill within hours. 6th form pupil Juliet Kenny, who's 18, tragically died on Saturday, surrounded by her devastated family after falling victim to the deadly bug. And a 21-year-old student from the University of Kent has also sadly died after contracting the disease. In Kent, investigations are focused on popular venue Club Chemistry, a 3-store self-described superclub in Canterbury. More than 2,000 revellers are said to have visited the venue across the weekend, linked to the outbreak, but officials reportedly fear the outbreak may spread beyond the county. Health expert Professor Devi Sridhar, who shot to fame as Nicola Sturgeon's favoured expert during the COVID pandemic, said people should see a medical professional immediately if they think they may have the disease. The personal chair of global public health at the University of Edinburgh also laid out the signs people should be looking out for. She said meningitis is a serious disease which needs immediate medical attention in order to prevent death and long-lasting health impairments. The key thing for people to know is to see a medical professional immediately if you think you have the symptoms, such as a high fever, stiff neck, severe headache and a rash. Antibiotics are the main way bacterial meningitis is treated, with general supportive medical care. Thousands of young people may have been unknowingly carrying the infection as they packed into parties and nightclubs over the weekend. Many students are from Kent, but large numbers also travel in from London and beyond and may have headed home to see family for Mother's Day. Officials are now racing to get a grip on the spread. NHS bosses and local health chiefs met for an emergency meeting yesterday to hammer out a plan and tackle the confusion. At least 11 people, all thought to be aged between 17 and 21, are seriously ill in hospital with the disease, with 1 victim believed to be in a coma. The disease causes inflammation of the brain and spinal cord. NHS Informed says meningitis can be spread by sharing utensils, cutlery, toothbrushes, as well as via sneezing, coughing and kissing. But vaping is not a transmission route of meningitis listed by health bodies. Professor Andrew Preston, Professor of Microbial Pathogenicity at the University of Bath, said it could spread in the same way that it would if 2 people shared utensils or cups. Not everyone who carries the virus or bacteria that cause meningitis in their throat are showing symptoms or sick. The bug has to cross the blood-brain barrier into the meninges, the protective membranes that surround the brain, in order to cause the disease. Trish Maynes, UKHSA's Regional Deputy Director for the South East, said students and staff will understandably be feeling worried about the risk of further cases. However, we would like to reassure them that close contacts of cases have been given antibiotics as a precautionary measure. Advice and support is being offered to the wider student community and to local hospitals and NHS 111, and we're monitoring the situation closely. The UKHSA has urged anyone who thinks they or someone they care for could have meningitis, septicemia or sepsis should call 999 and go to their nearest A&E.